Welcome to Osteoporosis in You, a slide presentation intended to help you limit your chances for thinning or broken bones. I'm glad you're here today to learn about osteoporosis. My name is Mary Pittaway. I'm a registered dietitian with the Missoula Health Department, and it's my hope that by the end of this presentation you'll have a better understanding of osteoporosis. The key to limiting your chances of osteoporosis is prevention and early intervention. This presentation will teach you how to identify your risks for this condition and learn the important steps to follow to help you prevent osteoporosis. During the presentation, you'll learn about normal bone growth and how this compares to bone growth in osteoporosis, symptoms of this condition, risk factors, bone density testing, and preventive measures. We'll also have a brief review of medications and interventions used to prevent or treat osteoporosis. So let's get started. What is osteoporosis? It's a silent disease much like high blood pressure or high cholesterol. You cannot feel the bones becoming weaker. Many people don't know that they have osteoporosis until they break a bone, and then it's necessary to treat aggressively. Osteoporosis occurs when the breakdown of bone occurs faster than bone formation, making these bones easy to break or fracture. The osteoporosis bone change is a slow process and occurs over years. There are many things that can be done to help prevent or treat this condition, and we'll discuss them throughout the slideshow. The earlier these changes are made, the better the chances of preventing or limiting the effects of osteoporosis, especially fractures. Once a person has been diagnosed with osteoporosis, drug therapy is usually started to help reduce the chances of fracture or reoccurrence of fracture. While osteoporosis is considered the disease of older postmenopausal women, it's important to note that osteoporosis can affect anyone, including men. Your health habits can have a major impact on the health of your bones. It's especially important that you take care of yourself through diet and lifestyle. And some of the lifestyle factors that we'll talk about include consumption of excessive alcohol, inadequate physical activity, or tobacco use. Even your health habits in the early teen years impact your bone health, as approximately 40 to 60% of bone structure forms and hardens during puberty or before age 14. It's never too early or late to consider any of the upcoming issues about osteoporosis. Let's take a brief look at the bone growth process. It's a continual process of formation of new bone, and at the same time, old bone is lost. Up until early childhood, or 20 or 30 years of age, new bone growth is greater than old bone loss. Usually we get our maximum amount of bone, also called bone density, by our mid-20s or 30s. After this, old bone loss is greater than new bone formation for most. It's normal for bone loss to occur as we age, and the amount of loss varies from person to person. The most rapid loss occurs at menopause, around 50 years of age. This loss slows down after menopause and continues at this rate till you're about 80 years old. Minimal bone loss continues to occur in women even after age 80. Men start losing bone around 50 years of age and at a much slower pace than women. Some men have large bone loss starting around 70 years of age. Osteoporosis is different from normal bone loss due to aging. Not everyone will develop osteoporosis as they age. The risk occurs when bone loss is greater and faster than bone formation. Bones are living tissue, and there's continuous growth of new bone and loss of old bone. Up until early adulthood, new bone growth is greater than the loss of old bone. And there are things we can do, and we'll talk about those, that can maximize the bone development and strength and density in the early years. As we talked about earlier, osteoporosis is silent, and most people don't even know they're at risk of actually having osteoporosis. But there are some signs that we can all notice and be aware of, so we get better able to determine if we're at risk for osteoporosis. By the time a person has at least 3 signs, it's usually assumed that they have had significant bone loss and are at increased risk for a fracture. These signs include a history of broken bones that happen with little impact, stooped or rounding of the shoulders, and a decrease in height of more than 1.5 inches. The woman in this slide exhibits all the typical signs of osteoporosis. See her rounded shoulders, and she has a hump on her upper back, and obviously a broken ankle. You can almost see the 1 to 2 inches of height she's lost. It's important to determine your risk of osteoporosis before these signs occur, and prevention is earlier to accomplish than the following treatment after a fracture has occurred. Who's at greatest risk for osteoporosis? Well, as in most public health issues, there are risk factors for the population that we can't change, and there are those that we can change. Those that we can't include family history. If one or more of your relatives have had fractures due to osteoporosis, you're at greater risk. White or Asian race is considered to be higher risk, although as more data comes in, we're finding that Native Americans and other races are also at risk. In fact, it seems like the only race or designation of individuals who are at less risk include the African Americans. Female gender, history of broken bones, aging, small bone size, and early menopause. Early menopause can refer to a total hysterectomy, or for women before the typical age of menopause, those who stop having periods early are considered to be have some issues relating to estrogen deficiency that will put them at higher risk for osteoporosis. Risk factors we can change are always more interesting in the public health venue because these are things that individuals and populations can really focus on to help reduce risk of future fractures. The risk factors we can change are low hormone levels, and that's treated through your healthcare provider. Low bone density due to little or no exercise, tobacco use or excess alcohol use, low calcium and vitamin D intake over the lifetime. Those with a slight build, if you start out your adult life with weighing less than 127 pounds, and people always say, well, who would that be? But there are folks that are small framed, and these people have less bone to work with, and so if they have any situations which accelerate bone loss, they're going to experience fractures earlier. And some medications can put you at higher risk for low bone density. The kinds of medications that might be considered risk factors for osteoporosis are listed here. The primary medication that seems to have the most influence is long-term use of prednisone or other steroids, but also anti-seizure medications and a contraceptive, Depo-Provera, may lead to excessive bone loss. This is kind of a complicated slide, but it just shows how many different factors can actually affect a person's bone density. And we won't have a chance to review all of them, but in general, a healthy diet rich in calcium and vitamin D and protein, and absence of excess tobacco and alcohol use, and plenty of exercise, and relatively stable hormone levels, and the absence of the medications that cause bone loss are really the formula for protecting yourself from osteoporosis. There are new ways of testing bone density, and actually due to some of these new technologies, there's been an explosion of information and medications available to treat this condition. Here are pictures of two of the more common ways of evaluating bone density. The slide on the left shows a woman having a heel scan or a peripheral bone density test using ultrasound. And this is the method that is used at the health department here in Missoula, and it's a screening tool that gives general information about bone density, especially lower body bone density. This, coupled with an assessment of various risk factors that we've just talked about, can give a glimpse or a picture that will predict the person's need for additional testing. If an individual has a peripheral test or a heel scan for bone density, and if there are other risk factors that might lead us to believe that there are problems with the different parts of the spine in that individual, from the health department, they would be referred onto their healthcare provider to see if they're in need of additional testing. The gold standard for bone density testing is called DEXA, DXA, and I won't tell you what that long word is that the abbreviation DEXA comes from, but suffice it to say that there are at least 3 really excellent sites in Missoula now where a person can have a DEXA, and this will give very good information about the health of the bone in the spine and the hip, as these are the more typical places that fractures occur. The FDA has approved these various devices, but the beauty of the DEXA, or what we call the central testing, is that it's so precise that it can allow your healthcare provider to monitor the effect of medication if that's prescribed to treat or prevent bone loss. But it's important to use the same device and location, if possible, for repeat testing and screening due to the differences in equipment and operators. So who needs bone density testing? Well, women, especially postmenopausal women, and those with 65 years of age or older, or any woman with a new fracture. All women over 65, and women who need help deciding whether or not to use hormone replacement or estrogen replacement or other osteoporosis therapy. Others who might need bone density testing include men or women who may be hormone deficient, and we talked about early menopause, or actually any time when in women they stop having periods, and there's other conditions that might lead to this, but the absence of estrogen will accelerate bone loss. And men who have testosterone deficiency are found to be at high risk for bone loss. Elderly adults, those beginning or on long-term prednisone therapy, or those with other conditions that are listed here that affect bone. And another group of folks that need bone density testing is those that are on medication to treat osteoporosis, so we can monitor the response. There are 2 phases of bone thinning. The first is low bone density or osteopenia, and the second is osteoporosis. We know when a person has lost a certain amount of bone density that there are different protocols in place to help repair that and slow the process of bone loss down. In osteopenia, the interventions may include changes in diet. They may include exercise programs. And for example, St. Patrick Hospital has a osteoporosis prevention and treatment exercise program specifically tailored to help those who have started showing signs of bone loss. Once a person's been diagnosed with osteoporosis, or having 25% or more of their bone loss gone, then different kinds of treatment are necessary. And these might include dietary changes, but they'll also often include prescription medications from their healthcare provider, and very specifically tailored physical therapy to help improve balance and help regenerate muscles that will support bones. This slide shows some interesting changes in bone that has begun to break down. The slide on the left, you can see the arrow pointing to a tiny place where this would be indicative of a fracture. And the fractures you see in bones, especially in the vertebrae, are very minute, and they may have no pain associated with them, and all you'd see, or all you'd notice, is that the person's decreasing in height or shrinking or curving their back a little bit, and that's indicative of tiny fractures within the different vertebrae. The picture on the right shows healthy bone, and you can see that the depth of the thickness of the bone in those, and the little holes in between are how blood and nutrients pass through the bone structure. This slide shows a picture of what happens with a hip fracture, and of course with osteoporosis, this is the most serious consequence of having low bone density that's not identified and treated early on. We talked about the importance of bone density testing to help a person determine their risk of future fracture. And we're particularly concerned about hip fractures because of the high mortality rate and the loss of independence that individuals experience if they do have a hip fracture. And when bones are thinned to the point of osteoporosis, they become very brittle and very susceptible to breaking. And I brought this model because it's designed to show the amount of pressure it would take to break the hip bone. And this looks like what a hip bone looks like. So I'm going to just put a little pressure on this and show you how little, that's how little pressure it would take for a person with osteoporosis to break their hip if they fell or twisted wrong. This slide shows a picture of how the process of bone loss shows in posture. And the woman on the left at about age 40 stands in an upright position, and she has plenty of bone in her vertebrae to support her posture. But over time, as those tiny little fractures may occur within the vertebrae, stooping occurs and the individual will lean forward. And we've seen this in men as well as women. And you'll notice the woman on the right has her tummy's pooched out. And this has to do with not only stooping forward, but when there's bone loss in the spine, you can assume there will also be bone loss in the ribs. And that rib cage actually shrinks. And so her posture changes, but so does the way her clothes fit. Another outcome of untreated bone density is the bone loss in the jaw that can result in tooth loss. In fact, the dental community now says that in addition to periodontal disease or infections of the gum, the bone loss that happens due to osteoporosis is the most significant reason for tooth loss in the older adult. So if you want to keep a healthy, happy smile, it's just one more reason to make sure you prevent osteoporosis. How do we prevent it? Well, getting enough calcium and vitamin D, either from diet or supplements, performing regular weight-bearing exercise, and we have some information on what kinds of exercise are particularly helpful. Reduction of tobacco and alcohol intake, balancing, getting good balance through a variety of physical activities to prevent falls and injury, and osteoporosis medications if indicated. Okay, let's talk about calcium and vitamin D to prevent osteoporosis. I love this picture because this looks like a scene from my kitchen when my sons lived at home. They'd take a carton of milk out of the refrigerator and just chug it right on down. Kids and teens need about 800 to 1200 milligrams of calcium a day, and that's about what you'd find in 3 full glasses of low-fat or skim milk. Adults need 1,000 to 1,500 milligrams a day. And if they're not able to get at least 3 good servings of low-fat dairy products a day, then that's the time when we start talking about calcium and vitamin D supplements. Supplements, you must also check that they have vitamin D supplement with them. It's the calcium to help with absorption. And you can get vitamin D from exposure of your skin to sunlight, but in states like Montana, there's only about 2 months out of the year when the majority of adults and children will get enough vitamin D from the sun. It has to do with where we are on the globe and the way the sun hits our geography, but all in all, the best sources of vitamin D are fortified milk, some fortified cereals, and there's a few other foods that we'll talk about in a moment. But again, if you're not getting enough calcium from dairy products, most likely you're going to need a supplement. Here's foods rich in calcium, and we're all familiar with dairy products, but some of the foods that you might not think of as good sources of vitamin D include calcium fortified orange juice, salmon, or other fish products. And this sounds a little odd, but you have to consume the bones that are usually very soft once they're in canned form. Cheeses, and there are some green vegetables that are also good sources of calcium, but it takes a lot. Foods that are rich in vitamin D include fortified milk, saltwater fish, and there's some vitamin D in egg yolks and fortified cereals, and of course always the multivitamins. There's some hints on taking calcium. If you're using supplements, you don't want to consume more than 500 milligrams of calcium at any one time because your body can't absorb it. Calcium carbonate products for some people are not as well absorbed, especially those who take antacids or are over age 60, primarily because they don't have enough acid in their stomach to really break the calcium down in a form that can be well absorbed. For these people, calcium citrate or calcium, the calcium citrate form is much better absorbed. So ask your pharmacist to pick a calcium citrate product for you. And the most common complaints about calcium include some GI upsets, and those are greatly reduced if the calcium supplements are taken with food. And so if you have a glass of milk, take your calcium supplement then, or if you're having a meal, that would be a good time to take it. Other changes in lifestyle: maintain appropriate body weight. And I mention this because young women and men nowadays who have eating disorders and are subject to starvation diets or very low calorie intake can have body weights drop to a point that they have inadequate fat stores and hence will have inadequate hormone levels in their blood. And this can maximize the degradation of bone. Tobacco and alcohol intake, we mentioned several times. Smoking produces a substance in the blood that actually causes premature death of the cells needed to produce new bone. So it's scary from a public health point of view to see young children, young teens using tobacco products or consuming alcohol to such a level, and that would mean even one beer a day would be enough to interfere with new bone development. And this is especially serious at a time when we know that bone density is laid down that will be depended on for the rest of a person's life. So in their teens, adequate calcium intake, drinking milk instead of pop, plenty of good weight-bearing exercise, and avoiding of those tobacco and alcohol will help assure adequate bone development for the rest of their life. The kinds of exercise that are most helpful in building bone, and again I mentioned St. Patrick Hospital has such a fine program, as do many of the exercise facilities in our community. But to exercise the muscles that pull on bone, you need about 20 to 30 minutes at least 3 times a week. And we use the phrase vertical jumping if done with vigor. And picture the kinds of things that would fit under vertical jumping criteria. Power walking, especially with a backpack, jogging, dancing, climbing stairs rapidly, or any kind of racket sports. All these activities help stimulate new bone growth on the lower part of your body and somewhat on the upper body. But we also need to consider weightlifting or heavy exercise on the back muscles, your arms, and the spine. And we don't want to imply that incorrect lifting is a prevention for osteoporosis. Any kind of lifting needs to be done with care and according to those good principles that reduce your risk of back injury but will help with spine bone cell development. Some exercise, although they're very good for us, will not really have an impact on bone, and those include things like water aerobics, walking, and the kinds of standing on one foot, Tai Chi. But what's so important about those kinds of exercises, they improve our balance and total muscle tone, which is important because if you don't fall, you don't usually break a bone. So in addition to having strong bones, we want to have a person with good balance and the ability to catch themselves if they do fall. As far as fall prevention goes, if any of you have a time to look around the house of relatives or friends who may be older, it's such a good thing to help them identify areas that might lead them to a higher risk of falling. Good lighting and good vision, sturdy step stools, avoidance of clutter and extension cords. the right kind of heels and non-skid soles, and learning how to rise slowly rather than jumping up. All these things can help a person reduce the risk of falling. Some of the drug therapies that we had talked about for a person who has identified bone loss, all of them include adequate calcium and vitamin D. Some estrogen replacement therapy or hormone replacement therapy, these are known to help reduce the risk of bone loss. There are also new medications on the market called bisphosphonates that help slow down the breakdown of old bone and allow that calcium and vitamin D intake to build new bone cells, and therefore you end up with a healthier skeleton than before therapy. And as you can see, there are new other medications that are less commonly prescribed but also helpful in reducing bone loss. The goals of hormone replacement or drug therapy include the following. We're trying to reduce or prevent broken bones, stop bone loss and stimulate new formation, and maintain the person's ability to perform daily functions because they know their bone structure is stronger. As far as hormone replacement therapy goes, it needs to begin right at menopause for the best protection in bone loss. It can still work if started years later, but the earlier it started, the better off for the patient. And the ongoing use helps prevent bone loss. There's controversy now about whether or not some women should or should not go on estrogen replacement or hormone replacement therapy, and our recommendation is to thoroughly discuss this issue with your healthcare provider, because although there are pros and cons, for some individuals they're not indicated, and for others it would be a shame if they didn't use hormone replacement therapy. There are many new products hitting the market that are supposed to help prevent bone loss and actually rebuild bone. Although it's our feeling that the majority of them, although they sound like they could be good, if there is inadequate testing of the product, then we're not really comfortable recommending them to individuals in lieu of the FDA-approved products that we just reviewed. Some things like yam cream and different kinds of soy protein, although they may be beneficial for some symptoms of menopause, will not protect or repair bone loss. And so you might be able to get rid of hot flashes and other symptoms, dry skin and such, but you won't be helping your bone density. So what can you do? Well, first assess your risks, know your family history, make sure you get plenty of exercise and adequate dietary intake of calcium and vitamin D, and talk to your healthcare provider about the need for an osteoporosis evaluation. Don't they look happy? I wish that was me right now. You can do it. Following the recommendations for prevention and treatment of osteoporosis can help you stay on top of this preventable disease. The moral of this story, I like this little picture, and it reminds me of the thought that goes along with lots of public health recommendations. If I would have known that I'd live so long, I would have taken better care of myself, is what this little lady seems to be saying, and it's something we can all practice. Think that we might live a long time, and what are we going to need to do with our health, with our lifestyle, with our nutrition, to help make sure that those later years are happy and healthy ones. Thank you, and if any of you have questions or concerns about osteoporosis, be sure and talk to your healthcare provider or give us a call at the health department.